Is Parkinson's an autoimmune disease?
Well, that's a very good question. So a lot of people are now thinking it is. So there's an issue with substantia nigra and the production of dopamine in Parkinson's and Parkinson-like disorders. I have always felt personally, in my humble opinion, that Parkinson's disease is more of a symptom of a bigger, worse underlying disorder. However, in the mainstream medicine, there is an ICD-10 code associated with Parkinson's disease. And once that diagnosis has been reached, the workup usually stops and the treatment starts. Now, as a functional medicine doctor, I don't think that Parkinson's just falls out of the sky and hits you on the head one day. I think that there's an underlying process, some other chronic disease, probably infectious disease, viral or spirochete or some other parasite that causes the body to generate antibodies against your ability to produce dopamine. So to answer the question, very likely, I don't think it's been proven yet specifically, but very likely Parkinson's, as is maybe some other types of dementias as well, and movement disorders, small fiber neuropathies and things like that are as a result of autoimmune.
So if you had a patient come to you that had already had a diagnosis of Parkinson's disease and they weren't responding to the treatments that they were given, what would you do to try and help that patient?
Well, at that point, traditional medical therapies, if they fail, then it's probably something more than Parkinson's. So my first goal would be to find out what is the underlying root cause, which could be a tick-borne illness, heavy metals, mold toxicity, a leaky gut, anything that could trigger off autoimmunity, like a viral burden of some sort. And if we can identify that and address that, then I think we would be in a better state to provide the patient with sort of a better treatment options.
Have you managed to help a patient with quite advanced Parkinson's using more natural therapies?
Yes, absolutely. So in my practice, it's heavy with Lyme patients. So I know that Lyme is an etiology for Parkinson's-like syndrome. So I would actually start my workup with ruling in or ruling out Lyme disease. And then if we treat the Lyme, and this has happened multiple times in my practice, the Parkinson-like features can dissipate. Now, not in everyone. Those who are far gone, who are in stage 4 of a disease process, late stage, sometimes there's no going back. There's so much damage that occurs that it's hard to recover. So there might be partial recovery. Like, for instance, their tremors may be lessened, or they may be able to get up and walk better, or maybe have better cognitive function. But will they make 100% recovery? Maybe not. So some of the folks in my practice come to me late stage. They've given mainstream medicine 10 years of their life to try to fix it. As they continue to get worse, and by the time they relinquish and fire their mainstream medical doctors and come see me, it's usually too late. So we're already behind the 8 ball. Occasionally, when I get people that come in early stage, then we have a better chance of making a full recovery for them. So it depends what stage they come in, and how late how long they've been suffering. What makes a big difference.